Good morning and welcome to the Long Island District of Seventh-day Adventist Health Talk. I have the privilege of being on this platform this morning to impart some much-needed information on an important health topic. For those of you who may not be familiar with me, I am Dr. Cara Dorsett-Pena, and I'm joined by my colleague and friend, Dr. Emmanuel Joseph, this morning.
Good morning, everyone.
So we've decided to share an overview of colorectal cancer. Last month, for those of you who may not be aware, was Colon Cancer Awareness Month. Despite this talk coming a few weeks later, the information we will share is still useful. But before we begin, we will open with a word of prayer. So let us pray. Eternal Heavenly Father, we thank you once again for another day of life. We thank you for health and the opportunity to share our knowledge with everyone who is listening on this platform this morning at this time. We ask that we are clear in our speech and that the words that we impart are well received, and may you clarify any misunderstanding that may be had at this time. We ask all these things now in your Son's name. Amen.
Amen.
All right, so let's talk. We're talking about colorectal cancer. So Joseph, did you know that colorectal cancer is the second leading cause of cancer deaths in men, following prostate cancer, and third leading cause of cancer deaths in women in the Bahamas?
No, I actually didn't know that. That's good to know.
Yeah, it is. So worldwide, it was found that in 2020, it was estimated that when they looked at a total population, there was 915,880 people who died from colorectal cancer, and that's just in 2020 alone. From this number, 576,858 persons were diagnosed with colon cancer, and 339,022 persons were diagnosed with rectal cancer.
That's a whole lot of people.
Exactly. And then the difference made up those who were diagnosed with some form of cancer that was found in the colon along with the rectum. So imagine that. Now, here's the thing. When found early, colon cancer or colorectal cancer can often be cured. The website cancer.net, which looks at cancer globally and in the United States, stated that the death rate from this cancer in 2020 in the United States was 57% less than what it was in 1970. Now, I guess we could figure that that's mainly because of improvements in treatments as well as increased screening, which allows physicians like myself and you as well to find any colorectal changes early before they turn cancerous and make a diagnosis and refer the adequate treatment. So why then is colorectal cancer death still so high, especially in our population? What do you hypothesize?
Well, it's a matter of people just not knowing and not knowing where to go, how to get screened. And I think it's more of a problem with screening and the knowledge of symptoms. Oh, I have this going on. I have this going on. And we'll talk about the symptoms later on. But when these things happen, they don't know. They think it might just be normal or just a stigma of, if I get diagnosed, then I'm surely going to die.
Right.
That type of thing. That stigmata of, if I don't know, I live longer. So we have that's also a big thing. But if we could get more of our population informed of what to do and when to start doing these things, I think we would have a better outcome. And that's my opinion on that.
I totally agree, and I am a strong advocate that knowledge is power. And the more you know, the more you have in your arsenal to actually carry out certain things and to prevent. So now I found it interesting but not surprising to learn that deaths in adults under age 55 continued to increase since the mid-2000s, and we've seen within our population as well that the number of persons who are diagnosed less than the age of 60 is actually on the rise. But my hypothesis, I agree in terms with persons not knowing where to go or what steps they should take. But I also think that as a Bahamian population, we have this hesitation of visiting a physician or seeking out to know, hey, that death that my grand aunt had, this recent death of a family member, was that due to some chronic illness, a cancer of some sort, or, was it just natural causes?
Yes, I think we have a lot of that. Our people die and we just chalk it up to, oh, he was sick, or she
Right.
was sick,
But we
or
don't.
mama was low.
Exactly.
And we're not sure what it was. And a good component that a lot of people don't know is that some cancers are hereditary. It might run in the family.
Yep, exactly. And then too, what I think is that as a younger population, we're not as active thanks to the ease of transportation and the comforts of our homes and business establishments. We're not as active as previous generations who actually did a lot of manual labor, from farming or even having to work in the tourism industry where they actually walked to work or used a bicycle to get to work. So I think that may be a reason too as to why in our populations we're seeing an increase in the number of diagnoses and deaths, along with what you had said as well.
You have to also remember, as it's piggybacking on the idea of the sedentary lifestyle we have. We're not exercising as much, and we have more fast food here than our grandparents, than the people from the islands as well. The Wendy's, the McDonald's, those things, the convenience of getting these things processed helps with lower our gut movement, of gut motility, and has a predisposition for us developing colorectal cancer.
Yes, I agree. So when we look at this slide here, there's 3 pie charts that we can see. So just
for context, and what are we looking at here? So in 2020, from the International Agency for Research on Cancer, in the Bahamas, the total population 393,248, with 876 being the number of new cases. And from the larger image at the center, we can see that of that number, 73 of those new cases were new cases of colorectal cancer, both in men and women. When we look at that number further at the top here, we can see that 32 were women with new diagnosis of colorectal cancer, and at the bottom chart showing 41 of the total were that of men that were newly diagnosed. The data further showed that 467 was the number of colorectal cancer associated deaths for the year 2020. For such a small population, those numbers are rather alarming.
Yeah. And what the data doesn't show here are those who were currently being worked up for a diagnosis, or those who were in that process and not diagnosed at the time that the data was reviewed. So we need to bear that in mind as well.
Yeah, so these numbers, although they're telling us the new cases, it doesn't take into consideration how much more persons were living with cancer at the time. So although these numbers are alarming, it could have been much worse.
Right, and even if we looked at it a bit further, it said that 467 was the number of colorectal cancer associated deaths for the year 2020. So that almost equates to about 1 or 2 persons dying each day in the Bahamas because of colorectal cancer, or the complications of colorectal cancer.
Correct.
Which is actually pretty scary.
Yes, that is. So, as we've been talking, what is colorectal cancer?
That's actually a good question. So colorectal cancer is a cancer that begins in the colon, which in layman's terms, basically the bowel or the large intestines, or the rectum. The colon is about 5 feet long, and colorectal cancer can occur in any section of the colon or the rectum. And here we have an image displaying the colon for you. So you can see that any part of this image can be affected by colorectal cancer. Now, colorectal cancer, also sometimes known as bowel cancer, it's basically the growth of uncontrolled cancer cells in the colon or the rectum, and this abnormal growth often begins as polyps. Now, polyps are benign growths on the interior surface of the colon, and we're actually going to take a closer look at polyps. What they are, what it means if found on colonoscopy, and what the next step should be if someone has the diagnosis of a polyp.
So at this slide, we have a great picture depicting polyps.
Mm-hmm.
The largest picture showing this image of the colon that has multiple polyps. To the right of it are pictographs showing multiple polyps as well in the colon. Like previously mentioned, polyps are abnormal growth. These polyps develop when cells do not grow and repair in the lining of the colon in a normal way. They can range from a few millimeters, very small,
Mm-hmm.
to several centimeters in size, and they can be flat or raised. It's possible to have multiple polyps that may be flat or raised, as if on a stalk.
Mm-hmm.
Polyps are one of the most common colorectal conditions, occurring in 15 to 20% of the adult population. They can occur anywhere in large intestine or rectum, as previously stated, but are more commonly found in the left colon, sigmoid, or rectum. Detecting and removing polyps early prevents them from becoming cancerous, as most cases of colon cancer starts as colon polyps. They can be removed and tested during colonoscopy, which we will discuss a little bit further. However, even after they've become cancerous, if detected early and effectively treated, persons diagnosed with colorectal cancer can live normal, active, and very productive lives.
Which is actually good, considering this is one of the only cancers where persons can either have a cure or go on to being more productive.
So, Doc, what causes colon polyps?
Okay, so we can actually categorize the risk factors for the cause of colon polyps and then colorectal cancer into sporadic personal history, which includes like environmental factors, the personal history of sporadic tumors, along with familial causes of colorectal cancer. We can also look at inflammatory bowel disease if a person has that, or any hereditary causes or risk factors. Now, when we also look at risk factors, we subcategorize those further into modifiable and non-modifiable. Now, when we look at the sporadic causes of colorectal cancer and colon polyps, the non-modifiable things would include things like a person's age. We can't change our age. We all age. We can't change our sex, no matter how. Now, in this day and age, everybody is trying to, diverge from what they were born as.
Biologically.
Right, what they biologically are. Whether or not you had a gallbladder removed can also increase your risk of colon polyps. And then you have hormonal factors for women in particular, because one thing that they look at is nulliparity, which is basically a female of childbearing age who has never had a live delivery. Now, that's not saying they never had an abortion, either therapeutic or otherwise, or a miscarriage. The age at which a woman actually first became pregnant, as well as whether or not they underwent early menopause. Now, as we continue in that first row where it says sporadic colorectal cancer, and we look at that second column, these are the me things that I do to myself, either intentionally, unintentionally, that can cause an illness or a colon polyp. And that basically is our lifestyle practices. What am I eating? Am I eating foods that are high in fat? Do I have a high fat diet, high processed food diet, a high meat diet, a diet that's low in fiber, low in folate, low in calcium? Because they found several studies where there was correlation where persons who had decrease in folate or calcium also were predisposed to developing colon polyps and then colorectal cancer. And then our sedentary lifestyle, we spoke on this before. Am I not moving my body enough? I don't know if people who exercise notice this, but when I used to run um, prior to COVID, the minute you get your body moving, your gut also moves as well. That allows you to have a bowel movement. So if I'm no longer exercising, moving my body, I'm increasing that abdominal girth, I'm gaining weight, I'm becoming obese. And then, too, what are we doing socially? Am I engaging in activities where am smoking? Am I consuming more alcohol than I should? And then you have persons who have a history of colorectal polyps in the past. And then those who also had a history of colorectal cancer with a recurrence of that same disease. And then persons who may have been diagnosed with small bowel cancer, endometrial cancer, breast cancer, or ovarian cancer, they are also predisposed to the development of colon polyps and then subsequently colorectal CA. Now, studies have linked inflammatory bowel disease, which includes ulcerative colitis and Crohn's colitis, to colorectal cancer as well, and mainly because the fact that inflammatory bowel disease, as the name states, I mean, it tells you what it is. Inflammation, high inflammation in the bowel. As a result of this, you have this chronic inflammation in the gastrointestinal tract. That leads to damage to the gastrointestinal tract, which now causes your body to have the chance to develop colorectal cancer or colon polyps. Now, as we continue to look down, we then have hereditary colorectal cancer. Now, the term genetic is not synonymous with hereditary, but it just implies that the transformation of a normal cell to a malignant or cancerous cell is achieved through the step-by-step accumulation of genetic alterations. And this concept basically fits well with the medically established polyp cancer sequence and conditions that persons look at in particular, and they try to manage these patients once they find out that they have this hereditary condition, such as like any polyposis syndrome, which just basically means that their risk of having polyps in their either the small intestine or the large intestine or throughout the gastrointestinal tract itself is just higher than the normal person. And these conditions are things known as like familial adenomatous polyposis, right, or your Peutz-Jeghers syndrome. Now, we spoke earlier about the importance of genetic testing, right? I know it's something that is very expensive, but I think in terms of persons who are trying to plan their families, it's something that should be considered with much thought, because you need to know what you're signing up for, what can be a possibility, and once found early, certain measurements can occur to allow for a child with a condition like FAP or Peutz-Jeghers syndrome to actually live a life where they don't have to worry about the development of colorectal cancer later on in their life, because there are surgical interventions that can be done just to ensure that they have a better quality of life.
Okay, understood. So just to summarize a few of to make sure I understand, and hopefully the readers understand, and listeners, that you have multiple ways that polyps can occur. They could come sporadically, which means out of nowhere. They could come due to having other diseases like ulcerative colitis or Crohn's colitis, which are inflammation, a disease that causes inflammation of the colon and rectum. Or you could have what is called hereditary conditions. These are things that you get from your parents, and they cause you to have polyps, most of them very early on in age. And if if you know, or if the family members know that they have this condition, they can be better prepared for their offsprings to know that, hey, I have, let's say, FAP, and my kids, knowing that disease, my kids might develop polyps a lot earlier, and they have a higher chance of getting colon cancer.
Right.
And for the sporadic causes, we have a few conditions as well that could lead us more towards the developing of cancers. You have our age, men are higher risk, the hormonal changes that females have put them at risk as well, having surgeries that you have to take out your gallbladder. Those are things that we can't change, but there are things that we can change in terms of the fiber that we eat. We need more of it.
Right.
Making sure we have our vitamins, folate, calcium, those things in place. Make sure we have an active lifestyle and try smoking cessation. Smoking is a big risk factor, and the alcohol consumption as well is also a risk factor.
Right.
So those are the things that, from what you've said, that I understand and hopefully want to get across to our listeners. It's a multitude of things that could predispose you to it, but there are some things that you can change, and those are the modifiable factors.
Correct.
All right.
All right then. So Joseph, what should I look for? Like, what signs or symptoms should I be more in tune with if I'm considering, hey, is this colon cancer that I may have, or how would I know if I even have polyps or colorectal cancer?
Okay, so one of the things is that colorectal cancer or polyps they present their symptoms usually when they have grown in size or when the cancer itself has had time to develop fully. Our gut, our large intestine, our colon, our rectum is a tube.
Right.
So, as like any tube, if you block something, if something is blocking it, there's a backup. And as that backup builds and builds, it is an elastic tube, it stretches. That stretching can cause a patient to develop abdominal pain,
Right.
belly pain, as we would say it. Belly pain, and when I term belly pain, the whole abdomen itself, not just your stomach.
Right.
And when this case is not just your stomach I'm referring to. So patients who come in with abdominal pain out of nowhere, they come to see their doctor. They may go through a multitude of testing, and one of the things that they can do is a scan of their belly. They can develop what we call obstruction. They might see that, and in investigating, they find that the cause of the blockage was a cancer or a large polyp. Right? So abdominal pain, although it's very common, one of those things that we need to be careful of or be mindful of. Why is this patient having abdominal pain? Why am I having abdominal pain? Could it be cancer? All right. The patients also can present with rectal bleeding, bleeding from the backside. This bleeding is usually painless, or you usually see it in the bowl, and that's the first indicator. Usually, that's one of the first indicators of patients, men in particular sometimes, going in and saying, this is odd, let me go check the doctor.
Right.
So rectal bleeding of any kind is a concern, but specifically bleeding from the backside where there's no pain is a big red flag. Changes in bowel habits. Now, patients who normally come in saying, Doc, I used to be regular. I used to go every morning at 5 a.m. when I wake up, I go to the bathroom. Now, all of a sudden, I'm going 2-3 days without passing stool. That's not me.
Right.
I'm not sure what's happening. Or the reverse. Persons who are constipated in terms of they take 4 days to go to the bathroom. They're noticing that they're going to the bathroom every day.
Right.
Sometimes the consistency of their stools is a little bit off as well. So people who had nice form stools are now having pebble-like stools, or it's more painful to pass their stools. That's an indicator that something is off with your bowels and of a concern, and raise red flags for you to go see your doctor. Involuntary weight loss is another factor. This is when you see those people who just all of a sudden they just start losing weight and losing weight and losing weight, and you start, in our population, when that happens, we start to wonder, is this person sick? They got something going on.
Yeah.
Unfortunately, the weight loss is due to the fact that this patient has some process in this case colon cancer, that's taking all the nutrients of their body, all their proteins, all the building blocks, and sucking it up to help build their muscles and keep their body fat and their body muscle. So that's why you would see these persons losing weight 10, 15 pounds in less than a month's time, or even more than that. And it's not necessarily because that they're trying to lose weight, but it's just happening.
Right.
All right. And these symptoms can vary from how fast they start to how quickly they spread, how bad they are, based on the size of the tumor, the polyp, the cancer, or based on where it is, whether it be the left or the right side of the colon, if it's in the rectum. These all play a factor, and if there's a presence of metastasis as well.
Right.
All right, so these are some signs that you could look for.
Okay, so that's pretty straightforward, but so it's almost like a snowball effect, almost like an avalanche. When that snow starts to come down that mountainside, it may start off even as something just that we may not pay attention to, like nausea and vomiting. So
yes,
if it's not necessarily abdominal pain at first, they may start off with nausea and vomiting. We like to write that off as, oh, I may have I ate something that was bad, or I may have a stomach flu. But if it's something that's been going on for a long period of time without any, no real, you can't necessarily define why, I think, go in and be checked at least. Patients may also have abdominal distension. It may start off as abdominal distension, but I want our listeners to also know that we're not talking about gas, because as a people, we so like to say, oh, I just have gas. This pain that I'm having is gas pain. No, this is something different. This abdominal pain, it may start off on just one side of the belly, and then it gets worse. It gets to the point where it's there all the time. And like I said, it's that avalanche type, that snowball type of effect where things are just going on. You may not have rectal bleeding because, it may not be in the part of the colon where that is more common. So the symptoms may be less common initially, like you said, because of the location of the cancer and because of the size. Something small may not be as sinister until it becomes so big and it's just like, hey, I'm going to make you notice me, Yeah, so I think that's a good recap, and hopefully our listeners understand exactly the importance of paying attention to even your bowel, the pattern of your stools. That's something that you should look at as well. And you mentioned the change in that pattern. It may go from nice formed stools to pebbles. Why am I all of a sudden now having these pebbles? Can't feel as if I have completely defecated. Maybe there is an obstruction somewhere. So those are things that are alarming that we should pay more attention to.
Exactly. And so now that we know what it is and the signs to look out for, what can we do? What's the screening for colorectal cancer? What is it, and what all it involves?
Okay, so as we mentioned, we said that screening is so important, especially in our population. We looked at those numbers before. In 2020, how many deaths we had? 476 deaths alone that were reported to the Institute for Research. So from that, we know that screening is important. We need to get these numbers down. And there are several ways that we can be screened. Now, as previously mentioned, colorectal cancer usually starts in the lining of the bowel, and it can be anywhere in the bowel. Now, if it's small, it may not present with any symptoms. And this is even more so why screening is so important, because you need to know, is there a colon polyp there? Can I remove it, get it tested, and move on with my life? Or what exactly is going on? And we said if it's left undetected and untreated, it can grow into the muscle layers underneath and then through the bowel to surround the tissues. And here we have a lovely diagram just showing exactly how a colon polyp progresses to cancer. It starts off just like a little bleb, and that bleb we call that like a hyperproliferation. And then it continues to progress. At that point, it's still benign, meaning that it's non-cancerous. It's just an abnormal cell growth, right? However, the body hasn't cleared it as yet. It hasn't recognized it as something problematic. And then it continues and it gets a bit bigger until it's an adenomatous polyp. You have a smaller one there and then a large one. It's still benign. Now, when you have this severe dysplasia, now it's a precancerous polyp. We can see that it's nice, it's starting to raise up a bit, and this abnormal cell growth where that arrow is pointing to, it just looks as if it's on its downward movement into that tissue, into the muscle of the bowel, right? Now, it's still benign, but it has that tendency to transform into a cancer. Then you have this nice, almost like a cauliflower looking
Mushroom.
a mushroom, right? It looks like a mushroom, a nice little stalk. This point, it's an adenocarcinoma. It's malignant. It's cancerous. And the last stage is where you have just invasive cancer. It's invading the muscle. It's going now into surrounding tissues. So colorectal cancer is just such a sneaky cancer. And because of this, screening is important, and there's different ways that we can screen. Before, you mentioned the symptoms of rectal bleeding. Now, for some, if the cancer is higher up, you may not see blood when you wipe. So we do a fecal occult blood testing, right? That's one way we can screen. Another way we can screen is through using a barium enema. There's also something called a flexible sigmoidoscopy or a virtual colonoscopy, and then we also have colonoscopy. Now, in the Bahamas, where most of the population is black, it is recommended that the first screening be done at age 45. And I would even go a step further to say that given the fact that the Bahamas is the 6th fattest country in the world, and I'm not making fun of us, but it's just facts, we should be encouraging persons to be screened maybe even earlier, especially if you're unsure of what your personal family history entails. If you're not sure that mommy or daddy had symptoms of colon cancer, may have been treated in secret, because it happens in our population. We don't talk about these things. We may need to start asking some questions, and then asking our physicians to say, hey, can I go ahead and get written up for a colonoscopy, or have a fecal occult blood testing done? Because the fecal occult blood testing is a little bit cheaper. It's cheaper than having a colonoscopy. So let's break down these screening tests. So the fecal occult blood, like the name says, fecal, meaning stool, occult, hidden, and blood testing. So what it's looking at is that it's a stool sample that actually looks for blood that is hidden in it, right? And this can be done on 3 different occasions, because colon cancer, it typically only intermittently bleeds. It doesn't bleed all the time, right? So it's still done to this day because of safety and then convenience.
It's one easier
it's
test.
right, and it's more personal. I don't have to go in, stool in a cup, and then take it in. You do this at home, drop it off to a lab, and the lab runs your tests and sends those results to your physician or to you. And it's non-invasive, Now, if this is positive at any one of those times, after doing it on 3 times, it should be followed up with a colonoscopy. Now, the barium enema allows the physician to see inside of the colon and the rectum to detect polyps, tumors, and or any changes in your intestinal tissue by means of an X-ray. The barium is a chalky liquid. The person drinks this. It's used to visualize what we call, it's like a contrast agent. So it allows anything that may be there that's not supposed to be there to light up, so it's easily seen. So it coats the lining of the intestine. Now, any abnormalities that's seen here, as you may guess, after having this done, if you have a positive barium enema,
Suspicious.
yeah, then you actually have to be referred for a colonoscopy.
Mhm.
Another way that we can screen is by use of a flexible sigmoidoscopy, and this type of test was known to decrease the mortality from rectosigmoid colon cancer when done every 3 to 5 years in conjunction with an annual fecal occult blood test. And this test is actually becoming increasingly limited in the screening and diagnosis of colon cancer. We also have the virtual colonoscopy. We became familiar with virtual stuff in 2020. So this is an alternative to colonoscopy. And all it is it entails the use of a CT scan images that constructs a 3D model of the colon. If polyps are revealed on this or any other abnormality, you actually still need to do a regular colonoscopy to have those polyps removed and then tested. And then, of course, after all of this, you're just saying, why don't we just go ahead and just do a colonoscopy one time? So the colonoscopy allows visualization as well as a polypectomy to be done as well, which is just the removal of the polyp or anything that may be seen. And that can then go on to be tested. And whatever is revealed, if it's negative or positive, then treatment can be started. So the colon cancers are rarely missed at colonoscopy, mainly because they tend to be larger than adenomatous polyps. And at colonoscopy, like I mentioned, the polyps are removed. It does, however, require that the patient prepares for 24 hours before the procedure in the form of a bowel prep or a colon prep. And what we've seen over the last few years locally is that a lot of gastroenterologists have started giving discounts for colonoscopies during the month of March, which is actually good. And they've noticed that a lot of people are taking advantage of these discounts. If you are signed up with NHI, you get a certain percentage of the discount. If you are a insurance holder, you get a certain amount. If you're self-pay, you're offered a discount as well. And I am elated to know that this is happening because now more people have the opportunity. They can plan and say, okay, I'm going to get screened in March. I can save up X amount of dollars to make sure that I have this done. You know, I mean, the test can be expensive. You know this. So it's very good that this is actually being done.
Okay. All right. So we have our screening methods. We have the from invasive to non-invasive, the simple testing of the stool for blood. We have the barium swallow where you get the chalky substance, you get your x-rays and you look for irregularities in your gut or colon. And you have the flexible sigmoidoscopy. You have your virtual colonoscopy, which I think was a great idea. And you have your actual colonoscopy as well, which is one the definitive method of diagnosis of that. It helps detect, locate, and sometimes possibly treat if it's just a simple polyp that's causing the symptoms. All right. So, Cara was mentioned. So your diagnosis of colorectal cancer is based on the colonoscopy done by a gastroenterologist or your surgeon that does it. They basically take the polyp or the tumorous malformation or abnormality from your colon. They take a piece of it or all of it if possible. They send it to the lab, and the lab tells you whether or not it is a cancerous change. They see cancerous change, they see cancerous cells, or if it's just a benign in a sense, non-cancerous growth. All right, and that's how the diagnosis is made. And during that time, if a diagnosis of cancer is made, there are some staging principles as this slide shows on the diagnosis, where you have from stage 0 to all the way to stage 4, where you have the cancer itself being only to the innermost lining or the inside of your colon itself or the rectum. They can grow to stage 1, where the cancer has not spread beyond the wall of the rectum or the colon. You have it goes up a notch, like the avalanche analogy that Cara mentioned, that the cancer spreads to only into the muscle layer of the colon, but it's only deep as the muscle goes.
Right.
And then you have your third stage where the cancer cell spreads to lymph nodes and areas around it, and you have stage 4 cancer where it goes beyond the gut itself. It goes to your bones, it goes to your liver, it could go to your brain, it could go to your lungs.
Right.
So that's when you have the metastatic process, or when we use the quote unquote METs in these patients. And once you reach that level, treatment is very, very difficult. And there's no cure for once you have METs.
Right.
Understood? So that's the diagnosis and the staging, and if we adhere to the proper diet, if we get screened early, we can detect these symptoms before they even reach the stage 0. So that's the importance, because as you can see, it's a progression from 0 where it's only in the lining to all the way where it goes beyond the lining and elsewhere. Hence the importance of early detection and early treatment.
Right. And I think what's also important to note is that when we continue to practice our bad behaviors and we don't do anything, even at the first sign of a symptom, it's almost like feeding a fire. You're just pouring gasoline onto it. I'm still going to eat my fatty meals. I'm still going to eat all the processed foods and high red meat. I'm going to consume all these things. I'm still going to drink. I'm still going to smoke. But I'm not getting screened. I'm not listening to what's going on with my body. I'm not listening to my body as it's ringing these bells that, hey, you need to check out what's going on the inside. And when those symptoms may first start, when you start to feel a little bit off, it may be just at stage 0. The size itself of that tumor doesn't necessarily correlate with the actual stage of the cancer, but we need to be aware of what's going on, and we also need to modify our practices. So if you're aware that, hey, I have a polyp, even if you got a colonoscopy, you got that polyp removed, are you going to go back now and still eat and drink the same things that you did? No, you're going to try and do a little bit better, but the goal is to try and try to be as good as possible so these things don't happen.
Like adopt a healthier lifestyle, and so that you don't cause more damage or harm to your body than what is already there.
Exactly, especially if you're not being screened, so you don't have any proof that something is changing internally.
Correct. So, what are the possible treatment options that our population have if, for say, they happen to be diagnosed with colon cancer?
Okay, so if colorectal cancer is detected, the method of treatment that's selected by the physician during their consultation or review of results, it actually depends on the stage of your disease. Now, if your cancer was detected early, surgery is often curative. So they may be able to remove that part of the colon where they notice a change in that tissue, right? However, when it's detected at later stages and metastases are present, like you mentioned, cure is less likely, and then treatment is often directed at basically keeping the cancer in remission. So as listed on the slide, there are surgical options as well as chemotherapy and radiation therapy. Now, when we're treating advanced colorectal cancer, even if it's spread to one or more lymph nodes, which is considered stage 3, it sometimes can still be cured. And the treatment that's prescribed would usually involve the combination of surgery to remove that part of the colon, as well as chemotherapy. So now I'm going to try and give you a medication that's going to help your body make newer cells that will respond differently. They're going to be programmed differently. Those new cells are now going to be more healthy brained cells. Occasionally, radiation is also necessary. Now, should your cancer return after initial treatment, and this is what we call recurrence, or if it spreads to other organs, that's when we have a difficulty with actually treating it or curing it. But what may happen is that they would have to either go through another round of chemotherapy just to relieve some of the symptoms and then to prolong life. Now, radiofrequency ablation, or RFA, is used to help with colorectal cancer. What it does is it's described as the power of microwave technology to help destroy those cancer cells after it's spread, especially to the liver or other parts of the body. During RFA, the surgeons and or radiologists, they use ultrasound guidance to place a thin needle. So we're just using an ultrasound to help us guide that needle into the center of the tumor itself. Once that needle, the tip of the device is there, it then emits radio frequency waves directing the heated energy to the tumor, and then it basically destroys the cancer cells within that tumor. It can also be applied during a surgical procedure or through the skin. We also then have palliative care, and this is in persons with incurable colorectal cancer. Palliative care is generally the best option for improving their quality of life, and if there is any obstruction present, surgery may also be recommended to just bypass the tumor. Another option may be the placement of a metal stent or tube to relieve that blockage while treatment is being administered. Now, if all treatment options are unsuccessful, the attending doctor may actually recommend discontinuing treatment, but allowing the patient to still relieve some form of pain control and comforting care.
Okay, so we have a few options. Ultimately, prevention is better than cure, but if we happen to find ourselves in a situation where we fit the demographic, we fit the bad health, bad eating, bad habits of life, and we start having these symptoms of belly pain, nausea, vomiting, weight loss, we go to our doctors early, we get the screen that we need, and they say that we have cancer, and it's detected early. We have options, whether it be chemotherapy, whether it be surgery, whether it be surgery with chemotherapy, but we have options.
Right.
And the best time to have these things done is early on. As you can tell, we're stressing the fact of early detection, early screening, knowing that you have it rather than sitting in, I would say, blissful ignorance of things happening to our body until it avalanches to a point of no return.
Right.
So, prevention is always better than cure, and what we can do to prevent these things, modifying our dietary habits, eating more healthy foods rich in fiber that helps our gut move much more freely.
Yes.
Vegetables, fruits, complex carbohydrates, cassavas, pumpkins, and sweet potatoes all help increase our fiber in our diet. Reduce the intake of all the red meats that we eat. I know chicken is bland, but chicken is also great for us. It gives us enough protein, a lot of protein, and reduces that oxidative stress that the red meat gives on our body. And we can, the foods, the alcoholic beverages. I know some people, it's hard to give up ultimately completely, but decreasing the amount that you take little by little until you get to a safe and healthy amount is always good. Patients who are always sedentary, then we need to get active. We need to get back outside, not on the couch, not watching TV. Those persons who have office jobs and then they go home just to go and watch TV. They come home, ideally after you get home or before you get home, you stop to the gym, you stop to the park, you take a walk, getting your steps in, as little as 30 minutes of steps, as little as 10,000 steps a day for a few days can help you drastically reduce your weight and be more active. It's not something that you need to do everything one time.
Right.
But slow progression is the best way to start changing and have a sustainable, healthy lifestyle. All right. Also, make sure you get screening if you have. Well, for those without symptoms, men and women at the age of 45, like the recommendations state. And even if you can get into your doctor's office a little bit earlier to
Mm-hmm.
get these screening tests would help you, especially if you have family members who've had colorectal cancer.
Yeah.
It's ideally you get screening a little bit earlier. But all these things you as listed can help you prevent or halten the progression of colorectal cancer.
Yeah, I agree. So the whole goal basically is to ensure that your colon is clean as a whistle,
Mm-hmm.
and all of these things that you just mentioned basically helps with that, just by keeping us active. And, I just want our listeners to understand that early detection and treatment results in a more favorable outcome. And I want us to be reminded that the Lord admonishes us in 3 John 1, verses 2, that, beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth. So if we claim to be Christians, we can't say then that I'm not going to look into what is wrong with me, because the Lord admonishes us that he wants us to be in good health. And now, one of the ways that we can ensure that we are in good health is through prevention. If you can't necessarily make any of these changes, lifestyle modifications or anything like that, you can actually then go and get screened. Know where you are, what's going on with your body. And knowledge is power,
Yes, yes it is. Yes it is.
So we've actually busted a few myths today.
Yeah, so a few myths that we commonly hear and that it goes around in society that aren't actually true is that most people think that colorectal cancer is a white man's disease, which it is not.
Right.
It is a cancer that affects both men and women equally. It doesn't favor men nor women,
Mm-hmm.
as you can see, and no gender is spared, and no race is spared either.
Exactly. And another myth that we busted is actually that you might as well get tested for colorectal cancer because it's deadly anyways. And what we found is that when colorectal cancer is detected early, there's actually a 95% survival rate. 95%. That is why screening is so very important. Now, once colorectal cancer has spread to the liver, it is usually deadly with only a 9% survival rate. But even in these cases, treatments are improving, and a method has now been developed to shrink this tumor, allowing in some instances for it to be surgically removed. And this has overall resulted in improved survival rates even in some of the most advanced cases.
All right. So, as well, another myth that we have is that I don't have a polyp, so I must not have colorectal cancer. Now, polyps are benign, harmless growths, and that, if left unchecked, have the potential to grow into cancers. Now, polyps can easily be removed during coloscopy, and not all polyps are precancerous, but they do have the potential to be.
Right, right. And another myth that we busted, I don't have any symptoms, so I must not have. Right, so another myth, like I was saying, was that I don't have any symptoms, so I must not have colorectal cancer. One of the most common misconceptions or myths is that there will be symptoms if a person has colorectal cancer, when in most cases there are no symptoms at all. Like we said, it's a sneaky cancer. More than half of the persons diagnosed with colorectal cancer had no symptoms of the disease. Symptoms such as change in stool, rectal bleeding, abdominal pain, and unexplained weight loss can all be indicators of colorectal cancer. However, once these symptoms develop, it is usually a sign of more advanced disease, like we previously said. And half the persons diagnosed after developing symptoms will actually die from colorectal cancer, unfortunately.
Oh, wow.
Yeah.
Okay, so another myth is that you don't have to You don't have to get screened regularly for colorectal cancer if you have regular bowel movements and feel fine. Actually, like we said, colorectal cancer is sneaky and a silent killer. There are no symptoms can actually let you know that you have colon cancer, and no actual symptoms in and of themselves, and can tell you that something's wrong with your body. But colon cancer, if detected early, can help you be cured. So just because you don't have any actual symptoms or that you feel fine doesn't mean that something's growing, slowly progressing until it avalanches into a host of symptoms. So early detection, early screening is important.
Yeah. So
I think that's a few of the myths that we had for today.
yeah, I just want to put a plug here for persons who may not be aware or maybe thinking to themselves, oh, everything that we discussed today is for the person who has insurance or some means of going to the doctor or going to a primary care physician privately to be seen to have these things done. Now, thankfully, that is not the case. With the inception of the National Health Insurance Authority, it allows every Bahamian, regardless of where you are, to sign up for free health insurance and to have actual annual testing done. You'll also be able to have your blood works done. You will see your regular physician, and all it requires is a simple enrollment. You can go onto the website, enroll, and be seen and try to take some initiative for your health. So it's not something that only the rich or the insured are, that it's afforded to.
Yeah.
We now, as a population, have the opportunity to go and seek the care from our own primary care physician. You don't necessarily have to go to the community clinic. The community clinics are there, however, but you do have the option to sign up for National Health Insurance, sign up with a physician who will know you, who will get to know you, and ensure that you are doing the necessary screenings for your age, your sex, and also anything that may come up when they gather more information in reference to your family history.
Awesome. That's good information for everyone to have.
Mm-hmm.
It's not, the lack of health insurance is not an excuse not to get screened because
Right.
we have options.
Right. So that's it for Let's Talk. I hope we have answered any questions that you may have in reference to colorectal cancer and given you some information that you may not have otherwise known about or even cared to look into. So thank you for joining us on Let's Talk.
Thank you. I hope you have a great Friday.
Thank you.